Kalimera, and that's it for my Greek, unfortunately. I'm trying to improve. After 4 years, there is a bit of progress, but not enough to deliver a speech in Greek. I hope in 1 or 2 years that would be possible. But first of all, let me say that it's really a pleasure. I'm delighted to be here. Let me, first of all, extend the gratitude for this invitation to the organizers and really to express our gratitude for the great collaboration we have to the Honorable Minister of Health, Mr. Adonis Georgiadis, Honorable Deputy Minister of Health, also the representatives from other public entities and other ministries, the representative also from the church, and basically to the organizers. This is really a very important topic, and I would like to congratulate you for taking this initiative forward. The size of the room and the number of people of the room is really a testament for the importance of this topic, and this topic is also very important for us at the World Health Organization. So, my dear ladies and gentlemen, colleagues and friends, it's really an honor to be here today, to have the opportunity to address this important event dedicated to autism, and I warmly thank you for the invitation. First and foremost, I would like to sincerely congratulate Thálpos Mental Health, and especially its president, Mrs. Athina Passiou, with whom we have an excellent collaboration, as well as ERISMA, Mental Health and Forensic Psychiatry, and its president, Mr. Petros Dounas, for organizing, as I said, this very important initiative. This work makes really a tangible difference. Raising awareness and supporting individuals on the autism spectrum with dedication and care is obviously extremely important. Just last week, we presented our new report, WHO Europe. We have an office dedicated to quality of care and with a very strong pillar on quality of mental health services. This report is reviewing the landscape of quality improvement for child and youth mental health in the WHO European region. It brings together the latest data to set the scene and improving mental health care across the life course. But it's not so much good news. Among the findings, we now know that autism affects a significant and perhaps growing portion of the population. In 2021, an estimated 2 million children and adolescents 0 to 19 in the region, in the WHO European region, were living with autism spectrum disorders. The condition, as we know, is potentially more prevalent among boys, but affects individuals across all demographic groups. Despite this, most health systems are still not equipped to deliver services tailored to the specific needs of autistic individuals, from early detection to ongoing support. So it's also a matter of quality. So our office here in Athens on quality of care and patient safety, with the support of the Ministry of Health and the government of Greece, is very well positioned to help and to collaborate with you in addressing this topic. As WHO reminds us, everyone has the right to the highest attainable standards of health. But that right is not always upheld. We have to acknowledge and humbly accept that. Especially with people living with autism, this is a reality. Services tailored to their specific needs and preferences remain not so common. Many health systems lack the training, the resources, the awareness to provide care that is appropriate, accessible, respectful, in other words, of high quality. This sometimes leads to late diagnosis, fragmented support, and unmet needs, and social needs as well. At the same time, we cannot overlook the broad picture. Within WHO European region, mental health disorders among children and adolescents are on the rise. They are increasing. 1 in 5 young people aged 15 to 19 experiences a mental health condition. Suicide is the leading cause of death among 15 to 19 years old. And most mental health conditions begin as we know, before the age of 24. So we need early quality intervention more than ever. This is why, with the great support from the Hellenic government, we have taken bold steps. We established the Athens Quality of Care and Patient Safety Office with a very strong pillar on mental health, quality of mental health services for children and adolescents. And I would like to publicly here thank the Minister and the Honorable Minister for your great support to our office here in Greece. From here, we are supporting 53 countries across our region. Our work is grounded in key pillars: developing quality standards, promoting innovation, involving young people, improving the data, and supporting countries to strengthen their systems and services, both across the region and, of course, mainly here in Greece. Last week, we proudly launched the first ever quality standards for children and adolescents' mental health in the WHO European region. And it's also a first time globally. This is a groundbreaking initiative, in our humble opinion, that sets a clear rights-based vision for care that is inclusive, person-centered, patient-centered, and effective. These standards will now be piloted in several countries, including Greece, so we need your help to promote them. At the same time, we work closely with the Greek government on a project called Health IQ, a national initiative to systematically monitor and improve the quality of healthcare services, with mental health at the top, firmly at its core, and supported by the development of very specific indicators. And of course, great collaboration with Deputy Minister Varsopoulos. We continue to provide technical support wherever it's needed. Notably, in a rapid assessment we just carried out to help strengthen children and adolescent mental health services. It is, however, worth noting that Greece is making significant efforts to strengthen child and adolescent mental health services. You're improving, doing a great job, including support for autism through the establishment of new facilities and the implementation of new legislation. Congratulations. These new mental health units across the country, they aim to improve comprehensive community-based support for individuals on the autism spectrum and their families. This is very important and is really a step in the right direction. As the World Autism Awareness Day approaches, let us remember, it is not a single story. It is a spectrum of human experience. Supporting people with this spectrum means ensuring access to timely diagnosis, inclusive education, family support, and community-based services. And above all, it means recognizing the rights and potentials of every single individual. As we work to unfold that spectrum through care, understanding, and inclusion, we must also unfold our shared capacity for empathy, dignity, and collective responsibility. As I finish, let me just say that I would like to extend also an invitation for a very important event that we are holding on the 10th of May, focusing on mental health of children and adolescents, open to civil society, the community, people living with mental health conditions, their families. It will take place at Zappian Garden. Zappian Garden. Everyone is invited. A really one day for children, youth, and their families, open to the public. Thank you very much. Sending my best wishes for a successful conference.